Hello everyone. During this COVID pandemic, for the surgeon, particularly for the advanced surgeon, laparoscopic surgeon, cancer surgeons, we are facing a lot of problem while operating. First, to screen the patient whether she is suffering from the COVID or not, so we have to go for the definite test, that is RT-PCR or the antibody test. Second, biggest challenge for the advanced surgery is the blood. The blood bank now are drying up with the stored blood because of the donors are not volunteered. So that's why for the advanced surgery to have a blood backup is a big challenge, and to get the blood is also a big challenge. So to understand the energy source particularly used for the advanced laparoscopic surgery is the most important and cardinal point, because while doing laparoscopy, the energy source plays a greatest role while dealing the bleeding and the blood vessels and capillaries all. So while talking of the energy source, there are five components of the energy source to be understood. The 5T you can say. Uh, 5T means first is the transformer what you are using, the whether it is a transformer for the ultrasonic wave, for the bipolar energy, for the monopolar energy, or the vessel chiller energy, that we have to understand that what transformer or what energy source I am using. The first and critical point. Second critical point is the T. Second T is the temperature setting. What setting you are giving to that transformer so that the energy output will delivered will be adequate for your surgery. That is very critical sense, because all the machines are tested and certified. You cannot just disqualify a machine saying that this is not working, this is a poor machine or poor company. All are certified company. That is what we must understand, that the what is the best energy output that I can get from this transformer. That is the second T. Third T is the tip what we are using. Whether we are using a cutting tip, the ball cuttery, loop, or even if we are using the harmonic or the ultrasonic energy, it's a straight tip or the curved tip. So it matters a lot, or whether we are using a shearer or the spatula or Maryland hook. So the energy output depends lot on the tip what we are using. That is the most important segment of the understanding of the energy. To understand, always observe how your tip is placed and what the tip is using. Sometimes the energy will not be delivered if your tip will be charred. So you have to rub up and you have to clean the tip. And that is the most important understanding as far as energy source is concerned, energy output is concerned. The fourth important tips for the energy source, fourth T is the tissue. Where we are applying, on a dry tissue, wet tissue, or in a bloody area, or something like ligaments, or a flaccid tissue, or a fascia, that you have to understand, because the energy output will be delivered, or what effect we will get depends on the tissue, whether the tissue is in the flaccid condition or the tense condition. If you apply energy on a flaccid tissue, it will not cut, so you will tell that this machine is not working. So you have to understand that the quality of the tissue and tensile strength of the tissue, and of course whether the blood or the or blood is present or not, and the tissue is dry or wet. If the tissue will be dried, the electrons will not be present inside the cells, and the energy output will be poor, because all the energy output is basically depends on the electron flow inside the cells. That due to the high flow of the electrons, the cells disrupts and produces the heat, and thereby coagulation is achieved. That is the basic concept of any energy source we are using. So that we have to understand. The fourth T is the tissue. And fifth most important component, the fifth T for the energy source, is the time of application. If you overcharge the tissue, the effect will not be there, because all the cells will be dried up, there is a charge, scar tissue will not carry the electron flow, and the energy output will not be achieved. If it's a dry tissue, if you will apply for short time, just brief time, the energy will not be sufficient. So adequate application, adequate length of application, adequate time of application is very very important as far as the adequate amount of the energy output is concerned. So those are the 5T that we must understand for the energy source. That is, first T is the transformer, second is the temperature setting, third is your TIF, fourth is your tissue, and fifth is your time of applications. Considering all and the blood necessity, all in advanced surgery, the ultrasonic energy stands a very good energy source. By saying that, I am not at all promoting an energy source, but I am telling from my experience, the ultrasonic energy, it creates its path, it acts by the mechanical energy mechanism, and there is less of the thermal damage, and that's why it works very very well. That's why the ultrasonic energy stands a very good equipment for the advanced laparoscopic surgery. But what matters a lot or most is the price effect, but the safety of the patient is very important whenever we are considering for the advanced laparoscopic surgery, particularly for the radical surgery. Well, you can go for the bipolar surgery, but it depends on your expertise and the machine's output and all. If it is there, you can go. Otherwise, for all purpose, the ultrasonic energy stands a very good energy source for an advanced laparoscopic surgery, particularly when the blood is in scarcity, you are not backed up with the blood, and you are going for the advanced laparoscopic surgery. So that's how, and you can choose you can understand what the energy source, and you can choose your machines, and you can choose all these 5T, and you must understand all these 5T before going for this surgery. Thank you everybody for watching this video. Thank you all.